Everyone, today I'm going to explain how to examine semen analysis, how to report semen analysis. So what is the indication of performing semen analysis? First one is the male infertility. Second one is the effectiveness of vasectomy to determine. First one is third one is a forensic cases, like in the case of rape case, in paternity cases, and sperm donation evaluation for IVF. First one is the infertility. So what is the definition of infertility by WHO? So any sexually active couple unable to conceive during a period of 1 year, it's called infertile couple. So in that case, the male patient should go for semen analysis. Second one is the effectiveness of vasectomy, like in the case of female, we perform tubectomy. So we cut the fallopian tube and ligate the both the end. That's the same case in the male patient. We cut the vas deferens and ligate the both the end. Like third one is the in case of forensic cases, like in the case of rape case victim, we examining the sperm examination, paternity cases, and final one is the sperm donation evaluation for IVF. So sperm donor are there in the IVF center, so examination of sperm of donor for IVF purpose. So first we should know the basic anatomy, how the sperm is formed and how the sperm is move around. So this is the very final, that is this is the very important, that is the testes. So testes is why testes is important, because the spermatogenesis happen in testes, in the seminiferous tubules. After fully maturation, the sperm are moved in the direction by a tube-like structure called the vas deferens and move into the one particular place. Here the two glands are important. First one is the seminal vesicles and second one is the prostate, because the most of the volume of semen is formed by the seminal vesicles and the prostate. First one is the seminal vesicles. Seminal vesicles secrete fructose. Two important things: first one is the fructose, second one is the prostaglandin. So fructose is very important for semen because it's provided nutrition or the energy to the sperm. And prostaglandin, why prostaglandin is important? It is secreted by seminal vesicles because the prostaglandin called the contraction of female uterine tract. So in that case, it will facilitate the motility of sperm in the female genital tract. Second one is the prostate. Why prostate is important? First one is it provides zinc to the sperm, to the semen, and second one is the most important, is the prostatic enzymes is very important to liquefy the semen. So first is the semen which coming out of the urethra is very thick semen, so it generally take 20 minutes to liquefy. Liquefaction is very important, and liquefaction is done by the prostatic enzymes. So the prostatic, if the patient semen is unable to liquefy after 20 minutes, so definitely there is either less secretion by the prostate or there is a blockage in the prostatic secretion. So why this anatomy is important, I am telling you with the one example. Suppose if the one normal patient with the normal testis size and volume comes to lab for semen analysis, and you will not get any sperm in the semen. So what is the possible cause? If the testis size is normal, spermatogenesis is normal, spermatogenesis is normal, but sperm is not moving in the particular direction, like there may be obstruction. First is there may be obstruction is vas deferens. Second one is there may be obstruction seminal vesicles. Third one is there may be obstruction prostatic secretion. So basic anatomy is important for this. Now come to the specimen collection. Specimen collection is very important. Why important? Because the most important instruction is the abstinence time. What is the abstinence time? Abstinence time is the period during which the patient is not performing any sexual activity or masturbation. So at least 3 to 5 days abstinence period is very important. Why it is important? Now I am telling you. If the patient which perform sexual activity within the 2 days and come in your lab for semen analysis, the sperm count is definitely lower. In the same opposite case, if the patient is not performing any sexual activity during a period of 7 days or more than 7 days and came for semen analysis examination, the sperm count is generally higher. So in both the case, we will get false positive or false negative reactions. results. So that's why the ideal abstinence period is 3 days, but it may be differ from 2 to 5 days, but should not be less than 2 days or should not be more than 7 days. Okay, now next one is we have to perform the semen analysis within 1 hour of the collection, including liquefaction time, that is 20 minutes, but according to some lab it is 30 minutes. So this is the main important. Failure to liquefy or indicating inadequate prostatic secretion. As I told you earlier, the prostatic enzymes is very important to liquefy the semen. If the semen is not liquefied within 20 minutes, it indicates there is something abnormality with the prostatic secretion, either blockage or decreased secretion. Okay, so after coming into the lab, we have to perform the following test. One is the physical, that is the macroscopic. Now second one is the microscopic. Third one is the bacteriological biochemical analysis, and these are the two important tests. First one is the immunological test for detection of anti-sperm antibodies. In certain condition, there is a formation of antibodies in our against our own sperm, so that anti-sperm antibodies need to be detected. So these are the two tests: immunological test, MAR test, and immunobate test. And this one is a very specific test which is not frequently performed in general lab, like a sperm function test, postcoital test, hamstring egg penetration test. Then most advanced is the computer assist semen analysis. So what we look for: physical examination, time for liquefaction, that is the ideal is 20 minutes, that is viscosity, volume, pH, and color. These are all the parameters must be included in lab report. Second one is there is a 4 thing for microscopic examination. First one is the sperm count by microscopic, sperm vitality, motility, and the morphology. And finally is the white blood cells. If the white blood cells increasing, it indicating that there may be something bacterial, gonorrheal, chlamydial, or trichomonal infection. Now next is the immunological, as I told you, anti-sperm antibodies test, bacteriological test, detection for infection, and biochemical test. Biochemical test, these are the fructose, zinc, acid phosphatase, and carnitine. We frequently perform tests for marker, like fructose is a marker for seminal vesicles, zinc is a marker for prostate. So we can indicate with the help of biochemical analysis, we assess the normal function of particular gland. Now final is the sperm function test, that is for special for IVF purpose. Okay, first come to the macroscopic examination. When the semen comes to your lab, how it's look on the neck eye, that is the appearance, normal appearance. So normal color is the gray white color, and its consistency is translucent. So when it is turbid, it indicates presence of certain infection. If it is red in color, it may be there is an infection or something abnormal, like a tumor of seminal vesicles, prostate, or urethra. So in that case, the blood is mixed with the semen. So final is the yellow color. When you will get yellow color semen, because urine may be contaminated or abstinence period is more than 1 week or 7 days. Okay, when the abstinence period is more than 7 days, there is a highly possibility that semen color changes from gray white to yellow color. Now come to the volume. So what is the ideal volume? Ideal volume is 1.5 ml to 5 ml. It is the ideal volume. So it's on the rough estimation, it is generally about the half of the teaspoon, normal teaspoon. Okay, so if the sample is less than 1.5 ml, what does it indicate? It indicates that there is something blockage in either seminal vesicles or there is a blockage in prostate, because most of the bulk of semen is coming from seminal vesicles or the prostate. Okay, now how to measure the volume of semen by the pipette. Now next one is the pH. pH is ideal pH is in between 7.1 to 8. So if the semen is more acidic or if the semen is more alkaline, both the conditions are too dangerous because it decreases the sperm motility. So if the how to measure pH, there is a pH paper, pH indicator, or if you are not having both of the two, pH paper or pH indicator test, you can perform pH by urine strip test. ठीक है, urine strip test is having pH indicator, you can perform pH with the urine strip test. Now next one is the liquefaction time. As I told you, ideal liquefaction time is 20 minutes, and liquefying agent is the prostatic enzymes. If the semen is not liquefied after more than 20 minutes, it definitely indicates there is something abnormality with prostate of that patient. Now come to the fructose level. As I told you earlier, fructose is an indicator of seminal vesicle. Okay, so in the case of seminal vesicle blockage, there is no sperm in the semen. So next step is to confirm the blockage. We have to check for fructose level. If the fructose level is decreased and the sperm count is also decreased, definitely 100% indicating there is something blockage in seminal vesicles. Okay, this is the ideal WHO criteria for semen. Volume is more than 2 ml, pH is 7 to 8, sperm concentration per ml, and total sperm concentration. These are the two different things. So ideal sperm is 2 ml, 1 ml containing 20 millions, so definitely 2 ml containing 40 millions per ml, 14 million total, and 20 millions per ml. Okay, now come to the morphology. 30%, more than 30% sperm must have normal morphology. Vitality is more than 70%, must be living sperm. Now WBC count is less than 1 million per ml, and most important thing is motility. First one is WHO divide into the two classes, class 1 and combined class 1 and class 2. Class 1 is the rapidly progressive the sperm which run in one particular direction, that is a linear motion. If it is moving to the right, it definitely moving toward the right. If it is moving into the left, it definitely moving linear direction into the left direction. So that is the fast movement, and the one particular direction movement, that is the rapidly progressive sperm, which include in class 1 of WHO criteria, because rapidly progressive sperm are more important, because this is the only sperm which can penetrate the egg of the female. Okay, now next one is the total, that is the combination of 1 and 2. So the total motility must be more than 50%. Okay, if the motility is less than 50%, we have to perform viability test by eosin. Okay, now the next one too is the immunological test for detection of anti-sperm antibodies, that is the immunobeat test, and mixed antiglobulin reaction, that is MAR test. Okay, now come to the microscopic examination, how to count the sperm. So this is the ideal method, that is the dilution by 1:20, 1% 1 ml of semen and 20 ml of diluting factor. So what is the diluting reagent? Sodium bicarbonate formalin diluting fluid. So 1 ml of semen and 20 ml, 1:20 dilution factor. Generally we can count with the help of modified Newbar's chamber, or more specific is the spermometer is there to count for sperm. So modified Newbar's chamber is the ideal to count the sperm on microscopy. So generally there is a we have to count in large 4 corner square. So I told you this is the central large 4 corner where we can count the sperm. So come to the high power. There is a 25 large square, 1 2 3 4 5, 1 2 3 4 5. So 5 into 5 equals to 25 large square, and each large square containing 60 small square. Okay, so we have to count any 4 large square, suppose 1 2 3 and 4. So to reduce bias, we have to count the corner 4 square, corner 4 large square, like this. This one is the first, second, third and the fourth. We have to count 4 larger square. To reduce the bias, we have to count the corner 4 squares. Okay, so this is the high power view of one large square. Every large square is covered by 3 lines, 3 white lines. So the sperm comes on this line are not considered. The sperm within that 16 boxes, 16 small boxes are count, and that particular 4 we have to sum that 4 larger boxes count and multiply by 15,000. So this is the microscopic picture. This is the one large square where you can see many sperm. So either you can count sperm manually, or you can count sperm by WBC differentiating counts, manual counts. Okay, and that one is the formula for counting sperm. That formula is very precise, very fixed. So sperm count is the number of sperm count on 4 boxes, correction for dilution factor, number of square counted, and volume of each volume of single square. So sperm count is maybe different for different patient, but the dilution factor is same, number of square counted is same, and the volume of one square is same, and the 1000 is totally same. So finally, if you are not remember anything of the above, just remember one sentence: sperm count multiply by 50,000. Okay, so for example, if you are counted 500 sperm in 4 large boxes, just multiply by the 50,000 and the final result will give in per ml. Okay, this is the ideal formula. So you don't need to memorize all the things, just remember one simple steps, that is the number of sperm count into the 50,000, and that result come as that is number of sperm per ml. Okay, now this is the some abnormal or normal term we have to mention in the lab report. What is the normozoospermia? Is the total parameter is normal. Next one is the oligozoospermia. What is the meaning of oligo? Oligo means less. So oligozoospermia is the sperm count is decreased below the 20 ml per ml. So oligo, that is also divided into the 3 category: mild, moderate, and severe. Less than 20 is the mild, 5 to 20 is the moderate, and less than 5 is severe. Second one is the azoospermia, is the absence of sperm in the seminal fluid. It's generally present in the case of obstruction. Okay, now next one is the asthenozoospermia. What is the meaning of stheno? It means the weakness. So asthenozoospermia is the decreased motility due to weakness. Okay, teratozoospermia. Terato means dead sperm. The sperm with the reduced proportion of normal morphology, though there may be a abnormal morphology like double head, tail coiled, or amorphous head. Next one is the necrozoospermia. All the sperm are non-motile or viable. Sperm are present, but all the sperm are either non-motile or non-viable. Now next one is the leukocytospermia. When the WBC count is more than 1 million per ml, we can call it the leukocytospermia. So these are the normal term which we generally mention in the report. Now come to the motility. How to measure the motility? What is the method? At least 200 sperm should be counted for normal motility, and remember one thing: more than 25% must be rapidly progressive sperm for normal morphology. Okay, so place one drop of semen on this glass and cover with the petroleum jelly to prevent the dehydration, because dehydrated sperm are non-motile sperm. So okay, so to prevent the dehydration, we have to cover with the petroleum jelly and at least count 200 sperm to report as a normal motility or abnormal motility. So there is a 4 grade according to WHO. First one is the rapidly progressive. Rapidly progressive means the linear forward moment. The sperm are move in one single direction in one single linear motion, or very rapidly progressive. Second one is the slowly progressive, slowly linear, or it may be curve moment. It may be not in one particular direction. Sperm can be move in either forward or reverse direction. Third one is the non-progressive. The sperm fixed in one particular place, but the only tail is moved. Next one is the immotile, that is the totally immotile sperm or dead sperm. So what is the WHO criteria? Normally more than 25 is the rapidly progressive, and total group A and group B, that is the more than 50% is the rapidly progressive or slowly progressive. So patient must have more than 50% motility to call it is a normal motility. So in the case if we will get less than 50% motility, we have to perform the viability test with the eosins. Okay, what is the concept of eosin staining for vitality? So this two sperm, that is the dead sperm which take the eosin. So generally in the case of dead sperm, the membrane is damaged and that eosin penetrate that damaged membrane and the sperm had taken up that the eosin. That is the basic concept. If the sperm is dead, it will take eosin. If the sperm is viable or living, it will not take a eosin. That is a very simple concept. Now come to the morphology. That is one is a normal morphology, head, body and tail. Now come to the what is the abnormal morphology. Sometimes there is a double head, sometimes there is a very giant head, sometimes is a amorphous. Amorphous means a irregular shape. That is the irregular shape. Sometimes there is a pin head, tapered head, constricted head, sometimes double tail or coil tail. So that one is a double head sperm, that one is a double tail sperm, giant sperm, and that one is a normal morphology sperm. So we have to report normal sperm count, motility and morphology and viability. So what is the causes of abnormal morphology? There is a infection, high grade fever, organic solvent cause the coiling of the tail. Some patient is having some chemical work in the chemical factory, there is chances that patient is having abnormal morphology of sperm. Then uses of illegal drugs, alcohol consumption, congenital testicular abnormality, varicocele is a dilation of pampiniform plexus of testes, and finally is the cigarette smoking. These are the basic reasons we have to rule out one by one in the case of abnormal sperm morphology. So this is the basic report, how to report the lab, how to report the semen analysis in the lab. First one is the receiving time, analyzing time. Now come to the important is the total volume. Now morphological, that is physical examination, pH, color, liquefaction and the WBC. WBC come under microscopic examination. That microscopic examination, sperm count, progressive, non-progressive, non-motile, and final is the sperm morphology. So this is the basic point in which we have to report the lab for semen analysis, lab report for semen analysis. And the final is the sperm anti-sperm antibodies, which is generally not performed frequently because very minor patient present with the anti-sperm antibodies. So what is the basic concept for anti-sperm antibodies? They are the two tests, MAR test and immunobid test. So these are generally detecting anti-sperm antibodies. Generally anti-sperm antibodies are IgG or IgA type. So we have to put one latex particle which is already coated with IgG antibodies. We mix anti-human globulin combined the two antibodies. Now we put the patient semen. So there are the two possibility. First one is the patient is semen is having antibodies, and second one is a semen is not having antibodies. So if the semen is having antibodies, so anti-human globulin bind the antibodies of semen to the IgG coated antibodies. So IgG of the latex particle bind with the IgG of semen. Very simple. So there is a attachment of latex particle with the sperm. So the sperm that is containing antibodies with combined with the latex particle antibodies, and we will see the attachment of latex particle with the sperm. So if more than 50% sperm are attached to the latex particle, it means that is the abnormality. Now come to the second possibility. If the antibodies is not present, so anti-human globulin itself bind with the latex particles and there is a formation of clump. So if we see a clump, it means there is no antibodies in the semen. If we see attached more than 50% attached sperm to the latex particle, it means there is a presence of antibodies, that is the significant amount of proportion. So this is the basic concept of anti-sperm antibodies. Now come to the biochemical analyzing. These are the some marker. For first marker is seminal vesicles, as I told you, fructose for providing energy to the sperm. Now come to the prostatic marker. There are the three prostatic marker: total zinc, acid phosphatase and citric acid. And there is a 2-epididymase marker of alpha glucosidase and carnitine. We have to perform all these biochemical tests, and the most important is the fructose level. Now come to the abnormal microbiological examination of semen analysis. We have to perform microbiological test. some common microorganism like Gardnerella vaginalis, Chlamydia, Mycoplasma genitalis, Ureaplasma uridilaticum may be frequently present in the sperm, or sometimes gonorrhea, gram negative bacteria may be present. So, thank you.